I remember seeing a video and what the Sands-Constellation Center for Critical Care was going to look like. And I remember just this true excitement. This is a once-in-a-lifetime opportunity to really work in an organization that invests something so significant into the community.
On paper, you could not imagine that this would be what it is. It truly is an incredible space for our patients, for our providers, for our staff, for the community. We're now at the doorstep. We're opening up those doors. You're going to hear from nurses. You're going to hear from doctors. You're going to hear from administrative leaders. You're going to hear from the people who deliver the care, the people who make sure that the things are in place for them to deliver the care, about what this building truly brings to all of us.
It feels like yesterday, Dr. Casey and I have a window that we can go look out, and we watch the steel beams going up. And I remember it taking shape. But for it to come to life seems, sometimes you have to pinch yourself.
Rochester General has been the referral hospital for our healthcare system. And we have a system that works in such a way that things from the periphery feed to the center that need to.
The new building really allows us to continue to grow and expand the services that we deliver to our patients.
And this building really looks for not just today, but looks for tomorrow, 5 years from now, 10 years from now, in making sure that we can provide the technology that can provide the care that can keep people close to home.
It's an enabling factor to allow us to do other things in the legacy parts of the building differently than we've been able to do them before. So as we look at all units, all departments, how many beds we have in this location or that location, it gives us some breathing room from a space perspective to do that thoughtfully, and then also provide renovations.
The aesthetics in there are warming. It's a comfortable space. It's a soothing space. It's designed to handle sound and noise differently than what exists in traditional hospital space. One of the things that's amazing about this building is, and this was designed well before anybody knew a world pandemic was coming, is all of the air in that building, as it passes through the air handlers in the building, is UV irradiated. Recirculation issues in this building are significantly reduced because of that.
Each of the units that are inpatient medicine units really allow us to have variable acuity or adaptable acuity model. What that means is that the rooms are built for any level of patient care.
In the Sands-Constellation Center for Critical Care, we're adding ICU beds to the community, real ICU beds. Not ICU beds in an operating room, not ICU beds in a post-anesthesia care unit, but ICU beds that are true ICU beds, built for ICUs, built with the monitors, with a plan to take care of ICU level patients.
Some of the programs that we're looking at into the future, new surgical procedures, new cardiac procedures, those sorts of things, really do require increased critical care beds as well as critical care trained staff. And so you have to have the physical space to be able to provide that excellent care. So these rooms are truly planning for the future. So certainly we'll have increased ICU capability. There are a ton of new technologies that are continuing to be looked at in terms of services for the OR that will continue to evolve and expand. We're dropping our gestational age in terms of the babies that we keep in our hospital to care in our hospital. Future oncology projects, really the list goes on and on. This is the foundational work that was needed to give us the facilities to provide that level of care.
This building brings all of that together, and it brings it together on a campus where people are used to delivering great care and want to deliver great care.
Rochester is blessed with tremendous health care. The building enables us to do things that we've not been able to do before.
Healthcare is about communities, and this building is about building for our community. It truly is transformative for Rochester General, Rochester Regional Health, and healthcare in our community.